Hello, I'm Pamela Coons. On the Road to Wellness is in Fernandina Beach. Fernandina Beach with Dr. Chris. And we are, we've done an interview with him today, and then he decided to touch my hand and figured out that...
This is very tender, yes.
And what is that about?
That's an acupuncture point that correlates with cervical dysfunction or dysfunction up in your neck area.
What does that mean for me?
That means I'd be surprised if you didn't suffer from either chronic sinus issues or headaches or head pain or something like that. And those symptoms you might have, you may not realize you have them. They're so slight, but you'll see after we mobilize. I'm going to treat your body. First of all, I don't treat symptoms here. I treat the body. So I'm going to give your body a treatment, and then this won't be tender anymore, and you will get up and you will feel better.
Let's see. I'm getting ready to get a chiropractic treatment.
Right.
We'll see how this goes. Thank you for joining.
Okay, I want you to lie face down there for me, Pamela.
Okay.
Good?
Okay.
Good.
Face down.
Yep. All right.
So tell me, what are you finding?
Okay, yeah, I'll be talking here. So we're gonna look at Pamela's structured frame here, and I'm just gonna be palpating and checking a variety of areas on Pamela. Okay. We're going into the hips here, and if I press here or here, it's going to be a little more tender for you on the left side, correct, Pamela?
Correct.
Right through here?
Mm-hmm.
Okay. So you might even twitch a little bit. That could be so tender down there, okay? So I'm just looking for basically imbalances, or I'm looking for balance, but I find imbalances structurally in the muscle tone, in the way the joints might be moving, in the way she's just lying down, the rotation of her feet. We'll check here and just see if we can get heel to the buttock. Okay, good. And then this side. There's a difference from side to side. Okay, that's good.
The yoga.
Right, she's very limber. Absolutely, that yoga is helping you. Helping you stay mobile. Because we talked about how movement is the key to life. The less we move, the closer to death we get. So movement is a huge importance. And with that movement, of course, we need good posture and mechanics. Yes, let's see. All right, I'm going to ask you to drop your arms down your side for me like that. Good. Okay. And we talked about that spot in between your thumb and index finger, letting me know that you had some issues or dysfunction up in the cervical spine. And they're going to meet. My hands are going to stop on areas that are going to be tender, right here. So areas need a little attention or need to be addressed.
What is all that from?
Oh, could be postural issues, could be accidents, some stress, scar tissue from trauma that you might have had in the past, whether it's a car accident or a fall or whatever, or just micro trauma from bad posture over the years, or not the best posture over the years. Okay.
I've been in 2 car accidents.
Absolutely. All these spots that I'm doing this acupressure or meridian therapy on now are actually acupuncture points, but I'm just doing a bit of acupressure. So I'm stimulating these acupuncture points, but also getting feedback from your body back into my thumb. Some spots are going to be more tender than others. Now, when we go to manipulate or mobilize the joints in your body, you might hear a little cracking or popping, and that's just a release of nitrogen gas from the joints in the body. Okay, it's a gas that builds up in the joints and it relieves the pressure, and that happens when we restore the normal mechanics or range of motion. Okay. All right, so I'm going to ask you to take a deep breath in. As you let the air out, I'm going to apply a little pressure and give a little push down. You might hear a little pop or crack. Okay, Pamela? Okay. Take a breath in for me. And all the way out. Good. And push the air all the way out. Excellent. Good. Okay, good. Great. Okay. Let you recoup from that a little bit. And we're going to take one more time. Take a breath in for me. And all the way out. Good. And push the air all the way out. Good. Okay, good. Great. Okay, a couple little clicks there, but nothing major. That's just good. That's telling me that your posture, as far as having your shoulders back and your chest out, is pretty good. I want you to flip over and lie on your back now for me. Now that I've plastered you into the table, right? All right. Okay.
Okay.
Yep, right in the back, good. All right. Good, that's perfect right there, good. Okay, nice. See what I see here? I'm holding your feet. Look at your feet. They look good. They're turned out and symmetrical. Some people come in and they're like this.
Oh, is that right?
Yeah, or they're over like this and they think they're straight up and down and balanced. They're not. So yes, I see that you've been adjusted before. That's for sure. That's good.
Yeah, I used to get adjusted when I lived in Iowa.
Near the Devin Palmer School of Chiropractic. Yep, yep. You just have to head relax, drop down, okay?
There were a lot of people being treated at that time for carpal tunnel. Remember that?
Yep.
And everybody, seemed like everybody had carpal tunnel.
Sure, yeah. It seems like a lot of conditions or issues like that are like, they come in vogue and it's like, well,
why is that?
Everybody's got it. You know, I don't know.
Hey, so listen, there are a lot of people who are dealing with autoimmune disease.
Yes.
Talk about autoimmune diseases and what you do.
I don't like the term autoimmune.
Okay.
I prefer immune deficient.
Immune deficient, okay.
Okay, because autoimmune means the body killing itself. And I don't think God made a body that would kill itself. So I'm not a big believer or fan of autoimmune. I'm more of auto-deficient. And that comes to, lack of nutrition causing the body to not have enough defense mechanisms to fight off bacteria, viruses, or infections or inflammation. Most of our immune system comes from our gut. It starts in our gut and comes from our gut.
Wow.
So, and our skin is directly related to our gut. It's just the opposite. So if I was to turn you inside out, your skin would be your internal lining, and your internal lining would be your skin. Because there's nothing gets inside our body until it's absorbed from the gut into our body.
Right.
It's just a tube going down from one end to the other. Okay, so after we're done mobilizing the cervical spine here, then we'll check that spot on. There we go. Good on your hand. Tell me that much less tender. Right? Yes. You did great. Usually it's something louder and worse than that coming out of people's mouths after I adjust them. Good. So let me see this hand again now. Okay, remember how tender this spot was?
Yeah.
And I'm pressing harder. Better, right? Okay, good. Just fold your hands up on the stomach here for me. Good. Great. Excellent. Okay, you did great. Okay, now I want you to lie on this side and face me over this way. Uh-oh. See? Okay, so lie right on your side and face me this way. Good. Okay, great. And just take this shoulder pad, I'll let it slide back, and this leg goes over the side. Excellent. Good. Okay, good. All right. Now over to the other side for me. Great. And this shoulder goes back, this leg over the side.
What am I supposed to do with this hand?
Good. I got you. Good. Okay. All right. Lie flat on your back again.
Okay.
All right. Good. Okay, let me have your hands up here over your head. Good.
Okay.
All right, Pamela, let's have you sit up here now and swing your legs over this way.
All right.
Okay.
Let me get over here.
Good. She's still breathing. Good.
Okay.
Okay, good.
So can you tell any difference?
Yeah, that's definitely better. Yeah.
Oh,
Let's see.
I look like Dorothy after the tornado.
Okay, stand up and tell me how you feel. You should feel a little bit taller, lighter, looser, able to stand up straighter and taller. And hopefully feel better in a different way or different in a better way.
That's nice.
All right, great. Thank you.
So, Doc, what, oh my goodness, here. I'm in Fernandina Beach, out from Jacksonville, Florida, with Dr. Chris here at Holistic Wellness.
That's right.
We're on the road to wellness, and I just received a incredible chiropractic treatment. It's amazing that an adjustment, the tenderness in this, my thumb has been killing me.
Yes, that seems better.
Yeah, I mean, just taking my clothes off and putting on, I thought I sprained my thumb. I didn't know what that was coming from. I don't know why I thought I sprained it, but I thought I sprained my thumb.
Right.
And you say that our body gives us signals all the time that something is wrong.
That's right. Yeah, I believe your body's talking to you all day long, usually whispering, but we're just so out of tune or out of touch with our body, we just carry on through our day. But yeah, body speaks to you daily, I believe. And if we can get in touch with our body and learn to listen to those little whispers or hear it and pay attention to it, it'll do us a lot of good to pay attention to the body and give it what it needs and answer it.
Not cover it up with medications.
Right, yeah, cover it up with pain medications or anti-inflammatories. I mean, what's causing the inflammation? Okay, yeah, let's just get rid of that inflammation. Well, what caused it? Get to the root of the problem. Otherwise, it's going to continue to reoccur. More inflammation. Okay, take anti-inflammatories. I feel a little better. Becomes inflamed again. More anti-inflammatories. And there's no prescription. I don't know of any prescription pill out there that doesn't have negative side effects. And you see TV these days. Some of these pills are just like, I don't know why someone would take that. May cause, diarrhea and or constipation, night sweats.
Don't forget
suicide, yeah, and all these things.
You might kill everybody in the house.
Yeah, why would I take that?
And then at the end it says, go tell your doctor to prescribe that for you.
Right, that's right, yeah. Let him know if you have any other liver damage or or liver or kidney issues that would really, be even worsened by taking this pill too.
And chances are it's a chemical going in your body, and you will have.
Right, liver or kidney issues eventually, yeah.
Dr. Chris, thank you so much for this adjustment today. I do feel so much better. I am truly amazed.
Great.
I am truly amazed.
Well, thank you for coming in here.
Yeah. We'll be back to see you. And thank you all.
Okay.
We'll see you
Bye now.
on the road to wellness at thewellnessradiotv.com. There is healing at the well.